Good evening, welcome to Cafdil Healthcare live here on Cafdil TV. My name is Shadrach Samuel Adenu. Tonight we are discussing poor immunization coverage here in the Central region and Ghana as a whole. If you can also join us on our Facebook Cafdil Cape Coast and then on YouTube Cafdil EDU. Let's go for this quick break. When we come back, I will introduce my guest.
Since time immemorial, God has always communicated himself and his will through various voices, the prophets, the kings, the judges, not forgetting John the Baptist, who was a precursor to Jesus Christ and gave us the will of God. We bring to you Voices from the Valley. This is a program designed by the Conventual Franciscan Friars in Ghana in collaboration with Cafdil TV to bring you in-depth insight in our faith, catechesis, and various Catholic teachings which will help you in your journey as a pilgrim. I know you cannot miss this program, and I highly encourage you that you shouldn't miss this program because it is Voices of God from the Valley of prayer and silence. Join us this and every Sunday at 3 p.m. and a repeat on Wednesday at 7:30 p.m. here on Cafdil TV and on our various social media platforms, YouTube, Cafdil EDU, and Facebook, Cafdil Cape Coast. Let us meet and share what God has for us through the Voices from the Valley.
Make me a means of your peace.
Welcome back from that break. If you just tuned in, this is Cafdil Healthcare live here on Cafdil TV. Tonight we are discussing poor immunization coverage. As I said earlier on, my guests are already seated. They are from the Cape Coast Teaching Hospital in person of Mr. Chandi Ephraim Azamandi. He is a public health nurse. Mr. Chandi, you are welcome.
Thank you.
And also Madam Sandra Vida Adai. She is also from the Cape Coast Teaching Hospital. Madam Sandra, you are welcome.
Thank you very much.
Hope you are all doing good.
As you can see, first in the year for us.
Sure.
Yes, I think we are fine. Grace have found us, we are fine.
You enjoyed the festive season?
Well, it's fine. It was okay.
Sure, that's great. How about you, madam?
Oh, the most important thing is we have life. So far as we have life, everything is fine.
All right, good. So let's set the ball rolling. Immunization. What at all is immunization?
Okay, so when we talk about immunization, basically we are saying that the ability of the body to create immunity against a particular disease or infection, okay? So the process by which my body will create the immunity is called immunization. So there are ways of which we make sure that this immunity is being created. Either you create it yourself or there is a stimulant from outside that will help you to create that immunity. So that is why we always give vaccines. So these vaccines will help you to create the immunity. So basically we are talking about immunization or immunization. We are saying that the ability of the body to create immunity against a particular disease or infection is what we call immunization.
Right. So now that we are supposed to talk about poor immunization coverage.
Yes.
Now that we've understood immunization, what is poor immunization coverage?
Yeah, so when we say poor immunization coverage, we are saying that are we able to reach all those that are supposed to be reached to help them to create this immunity? That is the question we ask. And those that we have even reached, have we been able to help them to create the immunity? That is what we ask. So mostly we use the dynamics to find out about the immunization. So let's say that every hospital or every district or every health facility has what we call our target population. Okay. So at the end of the year, when you look at your target population, children under 5, then you look at those you have been able to cover. Then you do the mathematics. Then you get to realize that have you achieved a higher coverage or a lower coverage? So that is what happens. So every district, every region. So we have district data. So we start with the facility level. We do facility data collection, district data collection. Then it goes to the regional data collection. Then it goes to the national data. So at the national level that they will be able to give us that, okay, in the year 2025, we had a higher coverage or a lower coverage. But then in our conversation, we get to realize that even with the immunization, we have various ages and what they stand for. So at some ages, the coverage is higher. At some ages, the coverage is poor. So when you lump it all together, so you realize that nationally last year, we did about 90 plus coverage. But when you sit down to read the cannibulations of that general district, you realize that it was higher in some age group, lower in some age group. So generally, we say poor immunization coverage. We are looking at, have we been able to reach our people? We can reach you, give you the vaccine, but at the end of the day, it didn't create immunity.
Right.
I think in our subsequent education, we will get to understand all these things.
Okay. Would you want to add anything?
Oh, just as he said, with the immunization, basically the focus or the main motive is for individuals to have some immunity against infectious diseases. So once you have it, it will protect you against a lot of infectious diseases, childhood ones, preventable ones, the penta, polio, yellow fever, measles. So once you have the immunization or you've built the immunity, it helps you to fight or prevent you from those infectious diseases. Yes.
Okay. But do you normally compare your ratings with the census tabulation, or you have your statistics, different statistics?
Yeah, so as I was saying earlier on, when they do the national population census, they come out with the age bracket.
Okay.
So when the age bracket is saying that we have 2 million children under 5, then they give the specifications. Maybe in central region it's 200,000, in this region is 200,000. So when we come to central region, so at the regional level, the Ghana Health Service at the regional level, they have the data of, let's say, we have Cape Coast Teaching Hospital, we have our catchment area, so they give us our target based on. So the immunization coverage is saying that we should reach at least 80% of our target. So they will look at the national census, the data that they have, then they will look at Adisadel district. Okay. Then when they look at it, then they will say, okay, no, Cape Coast Metro. So they will look at Cape Coast Metro and say that there are 200,000 children. So how many are from this zone? How many are from this zone per the census? Then they will say that, okay, where Cape Coast Teaching Hospital is situated, their catchment area, they have about 1,200 children under 5. So they strike out an 80% out of the 1,200, and they will give it to Cape Coast Teaching Hospital, saying that this is your target for the year.
Okay.
You understand?
Yes.
So yes, we peg it with the EPI national coverage. Which is 80%.
All right.
Then we also peg it at the census, giving us the number of children we are targeting. Okay.
Yeah.
Yes. So it's pegged statistically. It's pegged.
Right.
Yes.
Okay. So in your experience as a public health nurse, right, what do you think are some of the factors that is contributing to this low, poor immunization coverage?
Okay, so I'll start by saying that we have something we call vaccine hesitancy. So vaccine hesitancy is just that, it's saying that you know the vaccine is good, but you naturally
You
don't just want to take it. Okay.
Just like COVID.
Yes.
When COVID.
So right now the awareness have been created because attending child welfare clinic where we give the vaccines, it didn't start today.
Yeah.
If I can remember, I started way back, I think around 85 they were going, yes, around 85 it was there around that time. So all mothers at this age know that you have to attend, okay. But some mothers are still
hesitant.
Yes, to go. The other thing too, I would say, is that we have something we call adverse effects following immunization.
Okay.
Where we are saying that the side effects of the vaccines. Okay. So somebody might have gone for, you are my neighbor. I gave birth. I went to hospital. They gave my child vaccine. My child reacted to the vaccine, was admitted for maybe a week, and was discharged. So because of that, when I also give birth, I will not send my child.
But in this case, there are two different people.
Yes,
here.
that is what they don't understand. Because when you even let them know that you and I can eat from the same pot of food, I'll forsake you, not forsake. It's based on how our immune system reacts to whatever we gain. But you can't take it out of the equation. Our mothers in the house, the way they think are sometimes conjoined. They are like, they think in a twin way.
Yeah.
Then I'll add one, then my sister will add the rest. I also think that some mothers are also selective.
Yeah.
Yes, they are selective. They go for some of the vaccines and leave some. So
but
as I was saying,
in a particular one, how many are they supposed to receive?
So that's what I was saying, it's age bracket.
Okay.
You have to attend child welfare clinic to gain to go through the schedule from 0 to 5 years.
Okay.
Yes. So not necessarily.
So wait, break it down for us.
Yes.
From 0 to 5 years, how many are they supposed to receive?
So in all, you are supposed to get about 17 vaccines in all, but at different schedules. So we have 0 to 6 months, what you have to take before the year ends.
Okay.
We have at 1 year, at 18 months, 24 months, we have. But in all, from 0 to 5, you are supposed to take at least about 18. Yes.
So do you have parents who are very consistent that comes through for all the 17 or 18?
Yes. A lot.
How about those people who are not consistent? How do you handle them?
Well, we counsel them. We can't punish you.
It's counseling enough, because their children are supposed to take these, let's say, immune boosters to help them grow well, right? And then these parents are not consistent with the vaccination program.
Yes.
So as a health personnel, right?
It's good I'm with a female nurse.
Okay, so she would answer that, yes. So how do you handle such parents?
Okay, so with this one, I would say it falls under the socio-economic factor.
Okay.
Due to lack of education and poverty, some of the parents, you give them their next appointment and they will come defaulted, telling you they forgot or they didn't know. So when it happens like that, we talk to them. Even though you've defaulted, but we try as much as possible to counsel you. The most important thing is you've come today, your child is here for the vaccine. So we counsel you, we tell you the side effects, the importance of following to our schedule, the benefits your child will get from it. So some of them, when you talk to them, they get to understand. So you tell them, if you yourself, you cannot keep the dates, you tell somebody that you think can help you with it. It's just 4 weeks. So counting from today, 4 weeks from today. So if nothing at all, you can tell your husband, or if you have any educated person there, for the person to remind you of your next appointment day.
But wait, you have database.
Yes,
right?
please.
Yes, so database, before the person comes through for the weighing and all that, you have the person's contact.
So now what we are doing is we have their contact, so we try as much as possible to call some of them. Some people, you call them and they will tell you maybe they traveled. So they went to a different facility for it. For that one, we are okay with it.
Is that allowed?
Oh, sure,
Yes,
it's allowed.
okay.
Once you come here, wherever you are going, the weighing book is just like a passport.
Oh, okay.
You can go everywhere with it, and any health professional will see and know
What
which
you are
years what you are taking and where to start from. So just so in case you're traveling, go with your book so that you take the vaccine from wherever you are. So mostly when they come, we talk to them.
I want us to look at also one reason why we record a poor coverage too is also lack of logistics and human resource.
Yeah.
So we just as I gave the breakdown as to how the target is being given to the facilities. Okay, you realize that some parts of the country we don't have health services available there.
Okay.
Yes, so we usually do something we call outreach child welfare clinics to make sure that we give them. But also at some places, it doesn't even happen because you go to a CHIPS compound that serves about 4 communities, okay? Then you have only 2 nurses manning that place. So one, these nurses will have a difficulty organizing outreach programs every month. So it becomes difficult to get this vaccines or immunity for these children. So in such cases, you realize that, let's say, according to the census data, they are supposed to serve about 250 children under 5 years. But when you go to their clinical data, you realize that they'll be able to serve only, let's say, 90 something.
Wow.
Then it's not because it's them, it's because there is lack of human resource. And even in some instances where there is human resource, there is sometimes lack of logistics.
Yeah.
Where you run shortage
Of
vaccines, or you have vaccines, but what will send you to the point to meet the mothers or the children? You can't get anything to send you to the point.
So when you run out of vaccines around this time, what do you normally do?
So sometimes when we run out of vaccines, we are health workers. We sometimes borrow. Okay. So let's say Cape Coast Teaching Hospital, we have run out of some vaccines. We quickly call Adisadel or other facilities. If they have Adisadel, this clinic, AIFUA, around, we call them. If they have, we do 2 things. Either we'll refer our mothers to them to go and take it. But also, mind you, some of the mothers are there. They come to you because of the attitude or the relationship they have with the nurses there. So some, when they come and you refer them to go to a different facility, it becomes difficult for them to go and sort services there. So possibility is that they will not even go, they'll go back home. So it's either you refer them to the other facilities or you go to the other facilities and borrow the vaccines from them. So that when there is some available, you take and you replace those you've borrowed, because we account for the vaccines we take.
Okay.
We account for it. Even though per the protocol we have allowed wastage, but we account. We make sure that we use it. If it's for 20 people, we use it for the 20 people. So when we run shortage, we borrow. And there are some times that those you borrow from, they don't also have. And the whole region will go run shortage. You can go to a different region and borrow. If there's something you can borrow, fine. But there are also situations where the whole nation, national, you go national stores don't have it. So in those instances, when they come for weighing, you explain to them. You explain to them. So when you explain to them, they understand. When it is available, we top up.
Okay.
And that is why sometimes you realize that some nurses are having career and they are roaming about. We also do something we call door-to-door immunization services. And we also do something we call catch-up immunization services. So with the catch-up, every child you meet on the way, so I don't necessarily mean that the mother have sent the child, you catch the child and inject the person.
Is that allowed?
No, it's not allowed. Children, you need the consent of their parents before you give immunization. But when we say any child you meet on the way, we are saying that if my catchment area is interbedding, but this time around I'm not paying attention to my catchment area as interbedding.
Okay.
I just go around with the vaccine carrier. I've told myself that any child or any house I pass that there's a child, I will immunize this child. That is what we call the catch-up.
Okay.
You understand?
Yeah.
Yeah, so we run shortage, and whenever we get back the vaccines, we make sure that all those people that missed it, we give it to them. Because some parents are there, they've missed it, but they won't come again. They've lost interest in the system. So if you sit in the hospital waiting for them to come, they've lost their trust. So send it to their house, go and give it to them to restore that trust, and they will come the next time.
But then within the vaccines are supposed to take within a particular period, right? So what if the ones that are the shortage, right? You don't get them as early as possible. What will happen to the child?
Okay, with that one, I don't think there is no issue with that.
Okay.
Except that maybe the child is not due.
Okay.
For that one, we can't give. But when the child is due or overdue, we can still give. There wouldn't be any side effects.
Okay.
The most important thing is the child is at the age of that vaccine, and once given, it's okay. He or she will get the protection.
Okay.
And then adding to what Mr. Chandi said with the vaccine or accessibility.
Yeah.
Some people find it difficult to get access to it. Those are the cheap compounds or rural areas. Some have to travel with vehicles, motor, bicycles.
We have seen people crossing rivers just to get to people.
Yes, it's a canker. Because someone knows, say the child is due for vaccine today. She is waiting for nurses or the health workers to come to their area. But due to those barriers, they can't cross the river, a lot of challenges, they can't get access to them. So that also, it's a factor or a problem that is making it so difficult for us to give those immunization to those children. So it's also a canker that we are all trying as much as possible. So with time, things will be better. We are just growing. We are a developing country, you know, so we are hoping for the best.
But I think there are some things we need to put in place so that we could get these vaccines like in storage before we even begin there.
We are doing our best, and you know, with the logistics, we keep the vaccines in a fridge.
Yeah.
We have a fridge for it, so we can't just.
Is that the fridge different from the one we use in our various?
Yes, please.
Oh, okay.
Yes, please. And you see, some of those areas, electricity and other things. So we can't just keep them there. We have to keep them in a specific area whereby we carry them in a vaccine carrier. We monitor all those things, even with our fridges. We monitor the fridge temperature and other stuff. So those things will help us, because you can't just take any vaccine or keep it anyhow. It will spoil the potency of the vaccine. You will immunize the child, but there wouldn't be any protection. So we just have to consider those things as well.
Yeah, so let me add to it. So you see, you mentioned that when there's shortage and it comes, the child, the schedule. So you see, let's take this analogy. It's like building a house.
Okay.
You have a foundation, then you pick the blocks. So imagine you are building a house, okay?
Yeah.
Then after the foundation, you've laid the blocks up to a time, and you're expecting some money. The money didn't come. Then let's say about let's say 3 months, 4 months, the work stalled. When the money comes, definitely the other one already, rain has beaten it, but you have to continue to build.
Okay.
So in building immunity, we will need, so let's say if you need 4 milligrams of this medicine to build full immunity, but because of their age, the vaccines have been prepared with their weight and approximate weight and age. So the white man is saying that, or the black man, the one who made the vaccine, is saying that instead of giving this 4 meals to the child, it's too heavy for the child. Let me divide it into 3 times. So let's say it's 6. So let me divide it into 2, 2, 2, so that small. So by the time the child is, let's say, has taken it and the 3rd time, the child will get the full 6 to create the immunity. So this child will take the first 2, take the second 2, then the 3rd one will delay. But subsequently, when the third one comes, the child will still build the immunity. Yes, but we give them a schedule in such a way that we want them to get it as early as possible to build the immunity as early as possible. Okay. Yes, and as she was also saying, the vaccines from the national stores to regional stores and everything, we take vaccines according to our let's say utilization. Okay. So every health center, every hospital have data. We do monthly report. So if your monthly report is telling you that you attend to, let's say, 200 children for OPV every month, that means when you are making requests to the national, you have to pick around 200 to 220. You don't have to pick more than that. Picking more than that is only saying that you are not utilizing it, even though after a month it will not expire, but it will still be in your condition. It means that you are not taking it. So we pick vaccines from the regional medical stores based on our consumption. And the other reason is that we look at the potency here. We want to maintain the potency. As you were saying, I can vaccinate you, but you not build immunity. I can vaccinate you and the vaccine will just be like taking water. You not build an immunity. Either due to the vaccine itself, the potency have been lost before I gave it to you, or your immune system couldn't work with the vaccine to create the immunity. So vaccines and their handling is a bit technical, so you don't play with it.
Okay.
So even those people that carry the vaccines and travel to long places, the nurses, aside the journey that they suffer again in keeping the vaccine as potent as possible, because you are going and you have a reverse cold chain saying that 8 hours you have to change the ice pack. Maybe 8 hours not reach where you are going, but you have to change because you don't want to compromise on the immunity. And when children are falling sick of the diseases we are trying to prevent, it means that coverage is poor. So you get how the coverage is being analyzed. So we all sit in this room, we've all injected COVID-19. Yeah. But let's say we are 5, and 3 of us still fell sick of COVID-19. That means there was poor immunization.
So in this case, is it because of the storage or?
No, it's because, so now it's because the data will show that there's poor immunization coverage because you couldn't develop immunity. So automatically you don't have immunity against it. So it means that the immunization was what? Poor. So that's why I gave the difference. We have vaccination and immunization. You vaccinate. Vaccination can be 100%, but immunization can be less than 100%. Because as for the vaccine, everybody have seen that we've kept the vaccine, but I still fell sick of the illness, meaning you didn't receive immunity.
You have just gone through the pain, but
you didn't create any immunity.
That's serious.
So we always try our possible best to make sure that the potency is still intact. Yes.
Your facility, has there ever been a situation whereby you never got stock of your vaccines, as in you ran out of stock?
Oh, sometimes it do happen.
Okay.
Not all the time, but sometimes. And mostly, as Mr. Shanji said, if we don't have it, we can take it from other facility if they have. But if it is a national thing, then we just have to sit and wait till we get it. But not most times.
Okay.
Most of the times we have vaccines.
Let's get back to those stubborn parents.
Okay.
In your experience, have you ever encountered a parent that brought the word to the facility and then she was like, nah, I wouldn't allow you to inject him or her?
Oh yes, we do encounter such cases. You know, some people, they will tell you that a friend of my daughter went to the hospital, took the vaccine, and then when the person came, the child was sick. Because of that, I won't take.
Okay.
So in this case, you have to talk to the mother. Let the mother know the side effects of the vaccine. Sometimes temperature, the body temperature rises. Sometimes there could be pain at the site which is normal reaction of the vaccine, telling you that the vaccine is working, the body is building immunity. So all these things, when you see, it shouldn't create any hindrance. So you talk to them on that, and some people will understand. And when it comes to new vaccines, maybe we all know the routine ones, but now we are adding up another one.
Ones.
Let's say malaria vaccine is now here. So some people, you have to talk to them on several times before they will accept, knowing what now they are just trying the vaccine. So maybe if they inject my child, the child falls sick. So all these are challenges we are facing. But with education, counseling, and other things, they end up accepting it. Because when you say you've injected 3 people, 3 childs with malaria vaccine, then 1 or another 3 sets, they didn't vaccinate. They all fall sick, malaria. But the severity of those who took the vaccine will be lesser than those who didn't take. Meaning the vaccine works. And the fact that you've taken the vaccine doesn't mean you should expose your child to anything. Once you expose the child to infectious or in a society where there are a lot of infections, the child will probably get sick. So once you've injected your child or taken the vaccination, doesn't mean you should go and sleep without
mosquito net.
Treated mosquito net. So most of the challenges comes every day. Even with some of health workers, they will come, they will tell you they wouldn't take this vaccine because of that. But
even the health worker,
yes, you know, we are in the field of public health, immunization, and others too, they have their field. So when they come like this, you just have to talk to them, educate them on the importance of this.
But I thought it was going to be easy, a health worker and then another health worker.
That one, yes, that's the most difficult people that we, because for them, they know. So convincing them to accept it is very, very cumbersome. But with those who have less idea, when you talk to them, explain, they will just accept it.
But their immunity is also at stake, right? They meet a lot of people in the hospitals.
So it's just like COVID-19.
Yeah.
Somebody will tell you, I took the injection and still fell sick. So somebody sitting down who has not taken the injection said, if that's the case, I will also take it. But as she was saying, you see, all these vaccines is because of the understanding we have of it. So let's say that there's a bottle of water. The bottle is infected. And you took your immunization to prevent yourself from getting the infection in the bottle. After taking the immunization, you still go back and you are drinking that same water. What you are doing is that your body, in collaboration with the white blood cells, the body soldiers, have created a defense mechanism towards this one. But the more you keep putting the causative organism in the system, it will get to a time it will have more strength than the immunity you created. So in that sense, you fall sick. But the good thing is that the severity of the sickness is less and it's easy to manage. So when you take the vaccine, you don't go back doing what you were doing previously. So it's just like you vaccinate somebody with hepatitis B. Then you still explain to the person that don't go around indiscriminately exchanging shirts and toiletries with people. The person will not understand. Then at a point in time, when the B virus is so much in the person will start exhibiting symptoms of having hepatitis B. Then the person will say that the vaccine didn't work. You understand? So it's about you continuously infecting yourself from the source. Then you fall sick of the thing you want to prevent.
Let's go back to the communities where the demand for vaccines are low. What are some of the strategies you can implement to help them adapt to?
Yes, I know with some communities they brought system of rewarding mothers. Yes, so you see, some of these things is an internal motivation by the health facility to meet your target. Yes, because you see, the work we are doing, we deal with targets. So if you don't meet your target, every time when you go for a review, everybody have met their target. You've not met your target. So some facilities, they have their internal motivations that they get for their mothers.
Yeah.
So they reward mothers. Sure. Some facilities, they reward mothers. So they will tell you that this mother, if you are able to complete your vaccination, we are going to give you this. And some of them have also been recruited. Some of the mothers have been recruited to be the models of or change to the society. So where they send a woman who have successfully completed weighing, gained the certificate, then maybe they give the woman 500 cedis. Then this woman will come and share the story. Tell them it was difficult. When I'm coming, my husband doesn't give me money. Sometimes I don't get car, but I tried, I came. And my child have not felt sick up to now. Maybe the child is now 6 years. My child have never fallen sick. I've never gone to the hospital. And even when I finished attending, Antinez gave me 500 cedis, and I used it to start plantain business.
Motivation.
When you do that, you motivate. Look, it's because we are in the town and we don't see some of these things as motivation. But those down there, when you go there, trust me, even 100 cedis is a motivation enough. So that is one thing I know that some facilities do. They've instilled internal mechanisms to motivate them. And even some facilities, they realize that the children, when they inject them, the children will be crying, the mother will cry. So they will not. So some even buy toffees, biscuits. So the child come immunize the child is crying, you give toffee and biscuit, the child keep quiet. And also we do what we call school health services at the various communities. So if you can go to a whole community, let's say Wawase, then you realize that there are only 2 schools there. Everybody will send a child there. So you the nurse, if you say they should come for weighing, they have not been coming. So what you do is that you prioritize the school health services, where you write to the mothers that at the end of every month, when you are sending your child to school, maybe the last Friday of the month, add the weighing book. The nurses will come and do weighing at the school. Then the nurses move in there, they do. So with that, you realize that the mothers are not having time to come, but you have to go to them. You go to them to do the weighing for them. So I know, and some to do church, some to visit the church Sundays. If they realize that it's only 1 church in the village or 2, this Sunday they'll go and mount the weighing this thing there. The pastor will tell them to all come with their weighing card, then they do it there. So just as I said, they are doing a lot. We are doing a lot to get them. But when the logistics are not there, you can't force it. And when the human resource is not there, you can't force it. But you can't take unqualified people to go and do. When the problem
you need
comes,
to train more people.
The more people are there, but the gap is there. Some facilities, in fact, some villages, there are no facilities. So some of them, the chief will request, and they will come and do it at the chief palace. And once it's at the chief palace, everybody will go. So I think basically for now, that's what I know that other communities are doing.
Madam Sandra,
and home visits as well. They go to their homes. With that one card, it helps to monitor the child's schedule, especially with the mothers who are not elite and don't know when to come. You just look at the weighing book and tell them maybe the child will be due for this particular day. So the home visits also helps. Maybe if the child has defaulted, you encourage the mother to bring the child to the facility. So home visit too is another tool.
That's fine. Let's talk about misconceptions around vaccines. What are some of the misconceptions or myths that you've come across?
Okay, so I know some people will say that when you vaccinate a child for sick, as we said, it's just about the adverse effects. So if, as my sister was saying, when you're taking a vaccine, which is a new thing to your body, so the vaccines are made up of different things. Some are made up of live. They use let's say if it is a cockroach that causes the disease, they will pick a cockroach, then they will inject the cockroach and weaken it. Then they will take out the toxins from the cockroach and use the cockroach to prepare the vaccine. So the cockroach is not dead, it's alive,
Good.
but at a weakened stage. The reason being that because it's dead and it's weakened, it's weakened, when they inject you, it will go and attack your white blood cell, and they will fight to a compromise because it's weakened, so it can't outsmart your white blood cells. So they will fight together, and the white blood cells will now know that this cockroach, this is how it looks like. So it will prepare itself towards a cockroach. So whenever you come across with the cockroach itself, once the cockroach itself enters, the white blood cells know how to deal with it already. So the interaction between the vaccine and the white blood cells to form that immunity will have to bring out something. So what is it bringing out? In some people, their temperature will go up.
Okay.
In some people, the place will swell
Swelled up.
because it's a reaction. Something has to come out. You understand? So if you take vaccine, and these reactions we are talking is relative.
Okay.
It's not everybody that gets it. Some get it, others do not. So vaccines don't kill.
Okay.
And vaccines are not family planning methods. Yes. Some people will say that you are giving my child a vaccine so that when she grows up, she will not be able to give birth. They've heard that.
Really?
They've heard that the white people say we are plenty. So they want to make us infertile so that moving forward we will not give birth plenty. No, vaccines are not.
That's serious.
Vaccines are not.
I haven't heard of this one before.
Yes, it's there. So vaccines are not family planning methods. That is another one.
I see. Sister, would you like to top up?
Yes, and we have some people who come with AEFI.
Okay, what's
adverse
AEFI?
effect following immunization.
Okay.
So with that one, when we come, we will manage you. We will do labs, investigation to know what really caused that, whether it's the vaccine. So we take the date, you took the vaccine, the batch number of the vaccine.
Then you do follow up.
Yes, we do follow up to see whether it's the vaccine or it's something else. But whatever it is, we will try to manage you before you go home.
Yeah, so I even remember somewhere 2020, 2021, there was one particular strain of OPV that was causing a lot of problems amongst children. When we did the investigation, they realized that it was from the vaccine. They flagged the vaccine and brought it back. Once we take the badge number, then it goes to Noguchi and wherever they do the investigation and realize that it's actually having a problem. They will recall it back.
Yes.
So vaccines are not dangerous. Vaccines are not dangerous. As at now, since I started my practice, I've not heard a vaccine killing somebody. Yes. Even during COVID-19 that they said, rumored that vaccine killed somebody, when they did the autopsy report, it was not the vaccine that killed the person. So since I started work, no. And we have our various ways of doing it. And a woman carried the baby to the hospital, to the child welfare clinic, an outreach program, and the nurse was to inject the baby. Our protocols say that we don't inject a sleeping baby. We don't vaccinate a sleeping baby. So the nurse told the mother to wake the child up. The mother tried that, the child didn't wake up. So it means that the mother was carrying a dead baby, but she didn't know. So imagine that this vaccine, the nurse have ignored the protocol, injected the child wouldn't cry. The child didn't do anything. But when the mother goes back home and now realize that the child is dead, the mother will say that
it was
the vaccine.
Yes. So we are very careful with our vaccines and trust the system that when the vaccine is causing a problem, we will not bring it. Vaccines are 100% safe and they protect from diseases.
I think we need more education on it because a lot of people are not getting to understand the nature and then the use of these vaccines. So I think you have a lot of work to do by educating the general public on vaccines and then how to even appreciate it when these health workers walk into their homes and then their communities and all that. I think that's something we need to encourage them to do. Okay, if you just tuned in, this is Cafdil Healthcare, and then we are discussing poor immunization coverage. Let's go for a quick break. When we come back, I would ask him of his experience when he first injected a baby and then the reaction. Stick and stay with us.
Since time immemorial, God has always communicated himself and his will through various voices: the prophets, the kings, the judges, not forgetting John the Baptist, who was a precursor to Jesus Christ and gave us the will of God. We bring to you Voices from the Valley. This is a program designed by the Conventual Franciscan Friars in Ghana in collaboration with Cafdil TV to bring you in-depth insight in our faith, catechesis, and various Catholic teachings which will help you in your journey as a pilgrim. I know you cannot miss this program, and I highly encourage you that you shouldn't miss this program because it is Voices of God from the valley of prayer and silence. Join us this and every Sunday at 3 p.m. and a repeat on Wednesday at 7:30 p.m. here on Cafdil TV and on our various social media platforms: YouTube, Cafdil EDU, and Facebook, Cafdil Cape Coast. Let us meet and share what God has for us through the Voices from the Valley.
Make me a means of your peace.
Okay, welcome back from that break. This is Cafdil Healthcare, and then we are discussing poor immunization coverage here in the Central region and Ghana as a whole. Before we went for that break, I said I was going to ask Mr. Chandi of his experience when he first injected someone with a vaccine. So, share your experience with us.
Yes, so my first time I injected a baby. Actually, the crying of the baby didn't do anything to me. I felt normal. But after they left, then after the immunization program, what was going through my mind was that, oh God, please don't let anybody come back complaining that there's a problem. Oh, please. So you see, you will be having that thought that, you see, our society is in such a way that once somebody comes to the hospital, the person see you as responsible for whatever that happens. So if they go home and something happens, they will blame it on you, the nurse. So the first time, the very first day, I was like, oh God, please don't let anybody come back here complaining of a problem. But I wasn't actually worried about whether I've done well or not, because per our training as nurses, if you are actually a student who has undergone training as in training, okay, before you leave the nursing training, before you complete your 1 year mandatory service, you should be independent enough.
Okay.
Unless you went there and decided not to get trained. But if you are trained, you'll be okay. So at the end of the day, I thought about myself, how the experience will either damage me or motivate me. When after the injection, then a lot of people come back complaining of a lot of AFI, you have to also question yourself. If after that you hardly get people coming, then it means that you are on the right path and you only have to grow. There was a day I was in Abra. I was going to Abra to do something. The woman was carrying a baby, and the woman rushed to me. Papa nurse. I said, when I got home, the child's leg has swallowed. Blah 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 blah. I said, oh, but we don't say those things here. What was the education we gave you? I told you that when you go home and if anything, manage it this way. If not, come back to the hospital. So I quickly asked, how did you manage the swelling? Then she told me that she used ointment.
That was part of the teaching.
No. So I just told her that, Mama, so like, you make things difficult for us. Now I'm working. You've approached me. Anybody looking at me will just look at me that I'm not a good nurse or I'm not good at my profession. Meanwhile, you are the one that caused it. We told you that the place will get swollen. When it does, use ice block to manage the side. It will go because that particular vaccine is a combination of 5 vaccines together. So the strength is higher.
Okay.
And the swelling started, and you decided to use an ointment. When you use the ointment around the site, what you are only doing is that you are increasing the swelling and you are reducing the potency of the vaccine. So at the end of the day, who caused it? She now understood that she was a problem. And don't only look at it as people from outside. There was a physician assistant at Interbetin. We injected the child BCG. So mostly when you inject the child BCG, it forms a crust.
Okay. These are like the ones we all have on our.
So when you do it, it will form like a boil. Then you see the visible. You see it visibly. The pass inside it.
Okay.
Then it will burst and form a crust. And the crust is the protection. So that's why you are growing up with the crust. So when the thing, the pass came, she used syringe and withdrew everything, and came back the following day. And came the following day and was telling us that she, a physician assistant, and not only them, we have medical doctors. They do worse. But as my sister said, at the hospital, everybody in their training. Not everybody at the hospital, even the doctors, have had training of public health and the vaccines and co. So they don't know. So when it happens that way, you have to educate them. But the first time I did it was fun. I got up going home knowing very well that I've saved somebody's child from a sickness. Yes.
That's interesting. Madam Sandra?
Yeah, I think it's a prayer of every nurse to have a positive impact on a patient or on a client. So once you do something for a client, you just pray for a better result. So with we have a lot of experiences. But then with one of my experience, when they come like this, you educate them on what you are coming to give, the side effects, everything, every vaccine you're going to give today. You tell them, Madam, I'm giving your child this and this at the left, this at the right. This will be the reactions. So when it happens, do this, do that, do this. You tell them everything. But they will go and do the other side. So me, when you come like this, anytime you come, I will ask you, the last time you came, what did we tell you? Or what vaccine did your child take? The person will be there and tell you, they didn't tell me anything.
They have completely forgotten.
Yes, they didn't tell me anything. Someone would tell you something, even though she wouldn't be able to mention the actual, but then will tell you, oh, they told me this. Somebody would tell you, they didn't tell me anything. The nurse didn't tell me anything. And you open the book and you see your name there. And you realize you are the person who took care of her. Did your education, everything. But she will come and she will tell you, I met a nurse, she didn't tell me anything, forgetting that you are the person who took care of her. So another time, I think I took care of a client. She went home. Most of my clients, I have their numbers, so in case of anything, they will follow up. Yes, if I'm not around, or I'll even tell you to go to any nearby facility if there are challenges, and if it's beyond them, they will refer you. So one mother called me, the child was 18 months. She came for the vaccine and everything, went home. The next day she called me, Mommy nurse, my child cannot walk, she can't sit, she can't do anything because of the vaccine. And I said, so what vaccine? I wasn't there though. What vaccine did your child take? She said, at the upper arm. Do we use arm to walk? You see. So I said, you said shoulder, and you are saying that your child cannot walk. Even with the penta, the most painful one cry, They don't come with such complaints. So why since I said, oh, okay, if your child cannot walk, let's see. By evening, if so, she's not working, just call me and let's see. And later, she didn't call me. I called her. She couldn't pick. The next day, I called her. And now she was telling me, Sana, it's me and now I'm sorry. You see this. So when you hear something of that sort, you're just praying that nothing should happen. Sometimes it's not the vaccine though, but their mindset. You get it before they get to the hospital, like a normal course. So it's the prayer of every health worker that we get a positive feedback from our clients.
Okay. Mr. Chandi, I think our time is fast spent. Yes. Your final words to parents?
Yes, my final words to parents is that vaccines are safe.
Okay.
And vaccines will build your child's immunity.
Okay.
So take your child who is less than 5 years to the hospital.
Okay.
Let the child be immunized and let this child build immunity. Immunity that will protect this child for the rest of the life of the child. If your child falls sick of any vaccine preventable disease, you as a mother, as a father, as a parent, you have failed your child. You have failed your child, you have failed your family, and you have failed the nation as a whole. Because the nation uses our tax that we pay to procure the vaccines so that you will not fall sick. So if you are a mother or a father watching, it's not only for mothers, we the fathers. Sometimes show interest. Ask your wife to bring the child's weighing book. Go through the weighing book. When the child is due, you the father opt to send the child for weighing. When you men bring the children for weighing, you don't queue. We do it fast for you.
Oh, really?
Sometimes, yes. Sometimes you don't blame the mothers for not coming for weighing. Sometimes, genuinely, they can't make time or they are sick, they can't come. So we the men, we have to support them. So please, don't fail your child.
Okay.
If your child falls sick of polio, you, the father, have failed the child. If the child is growing with legs that the child cannot walk, anytime you see the child that the friends are playing ball, this child cannot walk, you have to blame yourself. Not, there's no Satan anywhere worrying you. Blame yourself. So vaccines are safe. Please come to the hospital. Go to the nearby health facility. Don't say your child is above any vaccine that the child misses. You don't decide that. Send the book and the child to the hospital. We will go through our schedule and see if your child is more than that. We know what to do. So please, if you are listening or watching, send your child for child welfare clinic. Thank you.
Right. Madam Sandra, your final words.
Okay. My final words, I would say that with mothers, when we vaccinate your child against any preventable disease, and you hear of any exercise going on, being NIV or MOPAP, please let your child take the vaccine. Because once we vaccinate your child, it doesn't mean the child has 100% protection. You wouldn't know. We can vaccinate about 100 people, and maybe 10 people wouldn't get the immunity. So once you hear of any MOPAP going on in the nation, please try as much as possible to engage yourself. And as they always say, mothers or about time, if we love our children, the best gift we can ever give to them is a good health. So let's try as much as possible to protect our children.
Okay.
All right. Thank you. Thank you very much for coming, Mr. Chandi Ephraim Azamandi, a public health nurse from the Cape Coast Teaching Hospital. And then Madam Sandra Vida Adai. She's also a public health nurse. Thank you very much for coming into our studios today to educate us on this all-important topic. We hope to see you another time. Yes, this is where time will permit us to draw down the curtain on today's edition of Cafdil Healthcare.
sorba modri Jesivo Megye no qual fama a sorba